Admission medication reconciliation. At admission, each patient must have their medication history reviewed and updated. In most cases, the nurse completes the medication history documentation. Reviewing and updating the patient's medication history is the first step in the medication reconciliation process. The importance of medication reconciliation cannot be overstated. Medication reconciliation can help to achieve compliance with accreditation and improve patient safety. Your patient has arrived in your unit from the ED. As a result, a medication reconciliation must be completed. To begin the admission medication reconciliation process, you must access either the medication list window or the orders profile window. Select orders from the menu. You no longer need to view the menu. To display more of the order profile window, click the push pin in the menu panel. Select the drop-down arrow on the reconciliation button and choose Admission. The Order Reconciliation Admission window displays with the patient's home medications and any inpatient medications that were ordered. All medications require action, therefore you must select Continue or Do Not Continue for each of the medications listed. If there is a medication that you wish for your patient to no longer take, right-click on the medication and select Cancel/DC. When you hover over a compliance icon, the notes entered by the nurse will display. The Tylenol, albuterol, and aspirin were all medications that were just ordered in the ED. You decide you want to continue those medications, so click the Continue Radio button for each of these medications. You decide you do not want your patient to continue taking the Lipitor while in the hospital, so select Do Not Continue for Lipitor. Select Continue for Cipro, Digoxin, and for Nexium. Because Nexium is a non-formulary medication, this box page displays. Click on Non-Formulary Medication. You will receive an interaction checking alert stating that interaction checking cannot be performed for Nexium, as Nexium is not part of our medication formulary. Select OK. Whenever there are duplicate medications and one is a documented med by history, the documented med by history should be discontinued by right-clicking and selecting Cancel/DC. For Lasix, we will continue the Lasix ordered in the ED, so select Do Not Continue for the Lasix prescription. And because the documented med by history Lasix is an exact duplicate, we will right-click on the medication and select Cancel/DC. There is a compliance icon for lisinopril. Once you hover over the icon, the notes entered by the nurse display. From the compliance comment, you note that your patient has a cough when taking lisinopril, and because of the cough, you do not want your patient to continue taking this medication. You want to Cancel/DC this medication. If you right-click and select Cancel/DC, the medication will be removed from the patient medication profile. However, if you select Do Not Continue, the medication will remain on the profile but will not be ordered as inpatient medication. Therefore, if you want to remove a medication from the medication profile completely, you must right-click and select Cancel/DC. Right-click the documented med by history for lisinopril, and from the drop-down list, select Cancel/DC. The documented med by history for lisinopril displays with the line through it. Select Continue for the sodium chloride 0.9% solution, and then click Reconcile and Sign. Your patient now tells you that she just remembered that she also takes vitamin D every day. You want to add this to your patient's medication history. Click on the Reconciliation button and select Admission. Click on Add. Because this is a documented med by history, you must change the type from Inpatient ED Acute Care Observation to Document Medication by History. In the Find field, you would type vitamin D, and from the medications that display, select vitamin D3 5,000 international units oral capsule. Your patient states that she takes no additional home medications. Select Done. The Details panel displays, and there are 4 missing required details. Notice that the 4 order details that are missing are highlighted. Your patient is taking 5,000 international units every day by mouth. Click in the Detail Values pane and select 1 capsule. To access the next required detail, you can either select the next highlighted detail in yellow, or you can click the yellow down arrow between the 2 panes. Select PO for the route of administration. For frequency, select Q day. When all details are satisfied, the blue circle will disappear from its place next to vitamin D3. You want your patient to continue taking the vitamin D daily, so select Continue for the vitamin D you just entered. You want to determine if there were any power plans that were added to your patient's chart while in the ED. Click the Manage Plans icon in the upper left corner of the Order Reconciliation Admission window. Select the ED Asthma COPD Power Plan in the Manage Plans window. Because you want to discontinue the ED Asthma COPD Power Plan, click the Discontinue icon. You do not want to keep any of the orders. You will notice that some power plans contain an Admit To order. Always keep the Admit To order by selecting Keep in the box to the left of the order. Click OK. Click Orders for Signature. Click Reconcile and Sign. And as always, it is important to remember to refresh your screen. You have finished the video for Admission Medication Reconciliation. Thank you.